All right, so let's dive into today's healthcare news. You know, the kind that goes beyond just reading the headlines and really gets you thinking about like what's changing
Hmm.
and why it matters to you.
Yeah.
We've got this fascinating mix of stories today, from AI making waves to the struggles with healthcare costs and access, all sprinkled with some good news about telemedicine expanding its reach.
Yeah. It's a lot to unpack, but that's what we're here for, right? To help connect the dots.
Exactly. So let's start with this AI frenzy that seems to be taking over healthcare. We've got GE Healthcare pouring $1 billion into an imaging AI deal with Sutter Health. Microsoft launching a whole new AI unit led by a former Meta bigwig. And Denver Health is getting in on the action with an AI assistant that's helping their clinicians cut down on paperwork. It's like AI is suddenly everywhere.
It certainly feels that way, and it's sparking a lot of important questions. On one hand, you have the potential for AI to truly revolutionize healthcare. Imagine getting a faster, more accurate diagnosis, or having your treatment plan tailored precisely to your needs. AI could also help free up clinicians to spend more time with patients, which would be a huge win for everyone.
Yeah, I can already see the potential benefits. But what about the potential downsides? I mean, we've all seen those sci-fi movies where robots take over. And I'm not quite ready for a robot doctor just
Yeah, all
yet.
right. Don't worry, we're not quite there yet. But you're right to be thinking about the potential challenges. Data privacy is a big one, especially when dealing with sensitive health information. And then there's the issue of algorithmic bias, where AI systems can unintentionally perpetuate existing inequalities.
Yeah, that's a good point. We have to make sure these AI systems are designed and used responsibly, especially in a field as important as healthcare.
Absolutely. It's going to require careful thought, robust regulation, and ongoing dialogue to ensure that AI benefits everyone and doesn't create new problems.
So AI is definitely something to keep an eye on, both for its potential to improve healthcare and for the ethical considerations that come along with it.
Now let's switch gears to another area where technology is making a difference. And this one has some really positive news. The DEA has finally given the green light for clinicians to prescribe buprenorphine via telehealth for up to 6 months. This is a game changer for treating opioid use disorder, especially for people who might not have easy access to in-person care.
That is huge. And it's not just about opioid treatment either. SSM Health has actually tripled their psychiatric care volume thanks to telehealth. That means more people are getting the mental health care they need, which is incredibly important.
It's really promising to see telehealth expanding access to care in this way. But there are still some hurdles to overcome. We need to ensure the quality of care remains high, address the digital divide that can prevent some people from accessing telehealth, and figure out how to seamlessly integrate it into existing healthcare systems.
Right, it's not as simple as just flipping a switch and making everything virtual. There are definitely some logistical challenges to work through. But overall, it seems like telehealth is a force for good, connecting people with the care they need, regardless of location or circumstances.
It's definitely a trend worth celebrating, and it will be interesting to see how it continues to evolve in the coming years.
Now let's turn to a topic that's always top of mind, especially when we're talking about healthcare innovation. Cost and access. It's great to have all these amazing advancements, but what good are they if people can't afford them or even get to them in the first place?
That's the million-dollar question, isn't it? And it's one that's becoming increasingly urgent. We're seeing rising healthcare costs across the board, insurance coverage gaps that leave millions without adequate protection, and administrative burdens that make navigating the healthcare system a nightmare.
And to add fuel to the fire,
Mhm.
there's this article we have about potential new tariffs on medical supplies and equipment. If those go into effect, it's just going to push costs up even higher.
It's a worrying prospect, especially when you consider that hospitals are already facing financial strain. We even have a story here about a hospital in Illinois that had to furlough dozens of employees due to budgetary issues.
It's heartbreaking to see healthcare workers bearing the brunt of these financial challenges,
Yeah.
especially when they're the ones on the front lines providing essential care.
It really highlights the interconnectedness of all these issues, costs, access, workforce, and the overall financial stability of the healthcare system.
It's like a giant puzzle where all the pieces are interconnected. And if one piece is out of place, the whole picture gets distorted. And unfortunately, it seems like a lot of pieces are out of place right now.
Yeah, it is a complex situation, and it's easy to feel overwhelmed by the challenges, but there are also glimmers of hope. For instance, California just passed some new laws designed to protect consumers from crushing medical debt. It's a small step, but it shows that lawmakers are starting to pay attention to this issue and looking for solutions.
That's encouraging to hear. It feels like for every step back, there's at least an attempt to take a step forward. And speaking of steps forward, we can't forget about the people working tirelessly within the system to make things better.
Absolutely. Despite the pressures they face, healthcare workers continue to be some of the most dedicated and compassionate individuals out there. In fact, nurses still top the list of most trusted professions, which is hardly surprising.
They truly are the backbone of the healthcare system, providing care and comfort on the front lines every single day. But it is concerning to see that trust in doctors has dipped recently. Plus, we can't ignore this report about rising workplace violence in healthcare settings. No one deserves to feel unsafe at work, especially those who are dedicated to caring for others.
It's a serious problem, and it speaks to the need for a more supportive and respectful work environment within healthcare. Thankfully, we're starting to see a shift in that direction. There's a growing emphasis on addressing burnout, promoting well-being, and creating cultures of safety and respect in healthcare organizations.
So what does that look like in practice? What are some of the ways healthcare systems are trying to support their workforce?
Well, there's this fascinating program at SSM Health where they've completely integrated their behavioral health team, including telepsychiatrists, into their electronic health records system. This makes mental health care much more accessible for their staff, right at their fingertips.
That's a fantastic idea. It's like they're practicing what they preach,
Yeah.
recognizing that their employees need and deserve quality mental health care just like anyone else.
Exactly. And the results speak for themselves. They've seen a significant increase in the number of staff members accessing mental health services, which ultimately leads to a happier and healthier workforce. But it goes beyond just mental health support. We're also seeing hospitals and health systems experiment with flexible scheduling, improved communication channels, and expanded opportunities for professional development.
It sounds like they're finally recognizing that healthcare workers are human beings with their own needs and challenges, not just cogs in a giant machine.
Precisely. And that investing in their well-being is not only the right thing to do, but it also leads to better outcomes for patients. After all, a happy and supported healthcare worker is more likely to provide compassionate and high-quality care.
It's a win-win situation for everyone involved. And speaking of looking at the bigger picture, there are a couple of news items that really highlight the importance of health equity and ensuring access for marginalized populations.
You're right. There's this KFF report that examines health coverage and care for children of immigrants, which brings to light the difficulties these families often face in accessing affordable and quality health care.
It's a reminder that policy decisions can have a very real impact on the lives of vulnerable populations. And we need to be mindful of the consequences, both intended and unintended.
Absolutely. And then there's another KFF fact sheet focusing on health coverage for immigrants in general. It's based on a large-scale survey and offers a snapshot of the current landscape and potential future trends.
It seems clear that health equity and access are going to be major themes in the ongoing healthcare conversation. And rightfully so. These issues are intertwined with everything we've been talking about. Technology costs, workforce challenges. It's all connected.
It is. And while the complexities can feel daunting, it's important to remember that by shedding light on these issues and encouraging thoughtful dialogue, we can contribute to a future where healthcare is more equitable, accessible, and effective for everyone.
That's a powerful thought, and it's something we should all strive for. Now let's shift gears and zoom in on some news about specific hospitals and health systems. I find that these local stories can really help us understand how these bigger trends are playing out on the ground.
I agree. For example, we have a piece here about Broward Health in Florida expanding their reach with 2 new medical office buildings. This is part of a broader trend of hospitals and health systems moving beyond traditional hospital walls to create more convenient access points for patients.
So it's not just about adding more beds anymore. It's about meeting patients where they are, making healthcare more accessible, and integrated into their daily lives.
Exactly. And this isn't limited to Florida. We also have news about a health system in Detroit opening a brand new behavioral health hospital, which is encouraging given the growing awareness of mental health needs.
It's great to see investments being made in mental health care facilities. It reflects a growing recognition that mental health is just as important as physical health and deserves the same level of care and attention.
I couldn't agree more. And speaking of integration, there's this interesting update from Common Spirit Health. They're making a big push to have a single electronic health record system across their entire network.
The quest for EHR interoperability. For those who might not be familiar with the term, it basically means having all of your medical records accessible to any doctor you see, no matter where you go within a health system. It's been a long-standing challenge. especially for large health systems that have grown through mergers and acquisitions, often ending up with different parts of the organization using different incompatible systems.
You explained that perfectly, and Common Spirit seems determined to make this a reality, which would be a huge win for both patients and providers. Imagine a world where your medical records seamlessly follow you, no more faxing or repeating tests because different departments can't access your information.
It sounds like a dream come true. Streamlined care, reduced errors, improved communication, the benefits are endless. But I can only imagine the logistical nightmare of merging all those systems and data.
It's undoubtedly a massive undertaking, but Common Spirit is moving fast and aggressively, as they put it. So it'll be interesting to see how it unfolds. It's a reminder that even with all the excitement about AI and other cutting-edge technologies, sometimes the most impactful innovations are about getting the basics right, like having a unified and accessible medical record for each patient.
Well said. And while we're on the topic of innovation, there's this exciting partnership between UCSF Health and GE Healthcare. They've joined forces to launch an innovation hub dedicated to pushing the boundaries of medical imaging.
That's intriguing. Details are still a bit scarce, but it's likely to involve things like AI-powered diagnostics, novel imaging techniques, and potentially even personalized approaches to imaging based on your individual needs.
It's fascinating to think about the possibilities. Medical imaging plays such a critical role in diagnosing and treating a wide range of conditions, so any advancements in this field have the potential to significantly improve patient care.
Absolutely. Now, before we wrap up this section, I want to circle back to something we touched on earlier, the financial pressures that are weighing heavily on hospitals and health systems.
You're right, those furloughs in Illinois were a stark reminder that even large hospitals are not immune to these challenges.
Exactly. And to add to that, we have this report about False Claims Act recoveries reaching nearly $3 billion in 2024, with a significant portion coming from healthcare fraud cases.
Wow, that's a staggering amount.
It is. It highlights the ongoing efforts to combat fraud and abuse within the healthcare system, which unfortunately remains a persistent problem.
It's a reminder that healthcare is a big business,
Yeah.
and wherever there's money involved, there's potential for wrongdoing.
Mm.
But it's also important to acknowledge that the vast majority of healthcare providers and organizations are committed to ethical and honest practices.
Absolutely. It's about finding that balance between holding bad actors accountable and recognizing the incredible work that so many dedicated individuals in healthcare are doing every single day.
Yeah, it really is a balancing act,
Mhm.
trying to address these like systemic issues, while also celebrating all the incredible advancements and all the dedicated people who make it all possible.
Yeah, it is. And I think that's a perfect note to kind of wrap up our deep dive into today's healthcare news. What stands out to you from everything we've discussed?
I think for me, it's the realization that healthcare is at a crossroads right now.
Mhm.
We have these incredible technological innovations like AI and telehealth that have the potential to like revolutionize how we deliver and receive care. But at the same time, we're dealing with these persistent challenges
Mhm.
around cost and access and equity. It feels like we're standing on the edge of something truly transformative,
Mhm.
but the path forward isn't entirely clear.
Yeah, I think you've hit the nail on the head. The choices we make now, as individuals, as policymakers, as healthcare providers, will shape the future of health and well-being for generations to come. It's both daunting and incredibly exciting.
It is. And that's why it's so important to stay informed, stay engaged, and keep asking those tough questions. We can't just sit back and passively wait for the future to unfold. We all have a role to play in shaping it.
Couldn't agree more. So to everyone listening, keep those conversations going, keep learning, keep pushing for a better healthcare system. And we'll be back here tomorrow to help you navigate the ever-changing world of healthcare news.
That's right. We'll see you then for another deep dive. Until then, stay curious and stay informed.